Dr. Andy here. Today I want to show you one of our in-office techniques for carpal tunnel syndrome, okay? So carpal tunnel syndrome is when we get numbness, tingling, and weakness in our thumb, pointer, and middle finger because of compression of the median nerve right here at the carpal tunnel. What's sitting right on top is the transverse ligament. And really what's going on is that nerve is being compressed, right? So sometimes it can get compressed through like swelling, maybe due to like medications or other health conditions. Nothing we can do about that. But a lot of times this is getting compressed due to repetitive stress injuries like typing away at your computer, so there's some swelling through that, or maybe some other musculoskeletal conditions that is causing inflammation and swelling that we are able to kind of take a look at, okay? Maybe there's a lot of muscle spasms in through this area as well, okay? So that's absolutely something that we can help with, so we want to address that, all right? So right through here, that means that we have nerve compression and probably a lot of blood loss, okay? So loss of blood to the nerves means that we're going to get some kind of nerve injury and can cause some of that tingling as well. So everything we want to do is really twofold. Increase blood supply to the area. That is going to quicken the pace of healing, so we're going to get faster healing. And then second, anything that we can do to maybe relieve some compression on that nerve, maybe by reducing some swelling or again, bring some extra blood flow to the area, that's a perfect technique, okay? And Graston is absolutely fantastic at doing that, okay? So we've got a couple of different tools that we're going to utilize, and we're not going to show you. Normally what we do is we throw some gel on this area to make sure that the tool glides nice and smooth. We're not going to do that today because we're utilizing this awesome tape to kind of show you where we get those symptoms. But what we're going to do is we're going to start all the way up through the forearm, okay? So the chances of there being a lot of muscle contractures through here are really, really high, especially if it's from a repetitive stress injury or some other kind of musculoskeletal injury as well, okay? So we're going to take scanning tools and we're going to be going through this whole muscle belly. What we're looking for is we're looking for where maybe it feels a little different underneath the tool. We're going to kind of feel that there's muscle contractions, muscle spasms through that area. You know, we're going to go right through the wrist. When we get to the smaller tools, we'll actually kind of go through the inner parts as well, okay? But when we get to the actual treatment aspect of it, so we kind of scanned it, we're going to assume we've located a bunch of muscle spasms, things that we want to work through. We bring out the smaller tools and we work in little star formations to get in there, break up the muscle spasms, get a lot of extra blood flow to this area. Basically, Graston is a manual therapy technique that brings a lot of blood flow to the area, oxygen to the area, and all of the hormones and chemicals that your body needs to start the self-healing process, okay? So this is really kind of like gearing up the self-healing, okay? So we're going to get into all those little areas where we can feel underneath, need a little extra TLC, and then we're going to get down into the wrist. And when we get down into the wrist, when we get towards this transverse ligament, we're going to go across the grain. You know, we're trying to spread this area out. Try to reduce as much pressure on that nerve as we possibly can. And we can go all the way through the palm, in between all the little bones. We can get down into the fingers on either side. You know, we can get the thenar pad or basically the thumb pad. Everything we're trying to do is we're trying to get blood flow and hormones and everything that this arm needs to start the healing process to make you feel better for your carpal tunnel syndrome, okay? So if it sounds like something that you're dealing with and you need help with, give us a call. We'll help try and work you through. We can get you on the schedule if need be. And always remember, if you have any questions, send them our way. And always remember to live with passion, not pain.